Seated. Welcome students, family, friends, faculty and staff, and everyone else has been kind enough to join us this afternoon. My name is Joan Caruso, and I'll be leading you through the ceremony honoring our graduating class of 2023 as they receive their long white coats. I am also joined by our PA faculty and staff. This group of professionals has poured their heads and hearts into this program and into our students. If I may, I'd like to briefly introduce them, even those that are absent. Dr. Dawn White, Dr. Deanna Denault, Professor Christopher LaPointe, Dr. Tushar Sursat, Professor Heather McKinnon, Professor Samantha Lucas, Professor Alana Brown, Emlyn Cohen, Tammy Monroe, and Morgan Beldock. Also joining us today is President Christensen and his wife, Seema. Thank you for joining us, as well as the founding dean of the Lewis School of Health Sciences, Leonard Johns. Thank you for all your service to our department and students. Without you, none of this would be possible. The collective faculty and staff would also like to extend the sincerest of appreciation to Barb and Earl Skip Lewis for their unwavering support of healthcare in the North Country and the pivotal role that they played in the development of the PA program in the School of Health Sciences, which is named in their honor. Thank you for joining us here today in a celebration that would not have been possible without your vision. It is my pleasure now to introduce our keynote speaker, Dr. Imre Rainey Spence. Dr. Rainey Spence is a local hospitalist provider and immense supporter of both our program and the PA profession in general.
Good afternoon, everyone. Good afternoon, graduating colleagues, their parents, families, and friends. Welcome to this celebration of the White Coat Ceremony for the class of 2023. My name is Imre Rainey Spence. I am a physician trained in internal medicine. I'm co-director of the hospitalist service and co-director of the medical intensive care at Canton Potsdam Hospital. I have been involved with the Clarkson University PA program in some way or another since the clinical rotations of the inaugural class. It is my great pleasure to be addressing you today. My introduction to the physician assistant profession was during my residency training in Cambridge, Massachusetts. I came to the introduction with no preconceived notions, as honestly I had never heard of a PA before. To be fair, I knew little or nothing of DOs or NPs either. MDs were the only medical providers that I was aware of. I am fortunate in that I was provided these introductions in an academic environment that encouraged collaborative thinking and the team approach to providing medical care. As my career progressed and I began to work as an attending physician, I started to notice some of the struggles that my PA colleagues were facing. As an Iranian-American gay man in medicine, I recognized some of the motivations behind the attitudes that my colleagues were regularly battling. Medicine, like every other aspect of life, progresses and evolves to meet the challenges and needs of the people of the time. The needs of the populations of the 1950s was very different from the needs of the populations of today. It is no longer efficient, effective, or appropriate to have a single branch of education for medical providers. How do we know this? Consider all the healthcare deserts that exist in this country, the most powerful country on the planet. 100 million Americans live in areas of this country that are designated health professions shortage areas. Nearly 80% of rural America lives in areas of the country that are medically underserved. Clearly, the models of the past are no longer meeting the needs of today. Politics in medicine is no different than the politics of bureaucracy. Those granted privilege have difficulty with change and the inevitable loss of privilege. The old ways are so entrenched that new approaches can be seen as threatening or dangerous. Limitations and boundaries erected in fear of what is unfamiliar. Ask any woman, gay man, or brown person you know. In this country, you are limited as you allow yourself to be. In order to secure your footing, you need to understand that glass ceilings are created by those who are afraid of what you are capable of achieving. There is a reason that you can see right through them. There is a reason that they shatter under pressure. In my career, I have had the great pleasure of working with some trailblazers in medicine, and many of them happen to be PAs. Mary Riley is one of them. Mary comes from a traditional Italian-American family. She was an athlete through her school years and discovered an aptitude for science. When Mary discovered healthcare, she explored every opportunity she could to help her find the road to this profession. Mary found out that she was accepted to this program when she was working as a waitress, standing at a table for two and presenting wine. She answered her phone on her way to the kitchen. At the other end was the voice of an interviewer she had met at the PA program at Clarkson University, and the person was calling to offer Mary a position in the upcoming class. After nearly collapsing, then bursting out in tears of joy, Mary accepted and began her journey to becoming a PA. She earned her master's degree, then completed a one-year internship with the hospitalist department at Canton Potsdam Hospital. Mary has been a hospitalist ever since. Mary evaluates, admits, cares for, and discharges medical patients with equal complexity to her physician colleagues. She works autonomously. Her work is meticulous. Her medicine is excellent. She does the right thing because it's her nature. She is intellectually curious. She is compassionate. She advocates for her patients, and she is trusted by her colleagues. Mary is an exemplary medical provider. Sarah Mohadis also graduated from this program. Sarah completed a one-year internship with the hospitals department at Canton Potsdam Hospital and has been with the department ever since. Sarah took a special role during the heart of the COVID-19 pandemic. Sarah became one of the primary members of the COVID-19 ICU, where she cared directly for the sickest patients in the county. Sarah used that time to learn the foundations of critical care medicine and became proficient in all of the procedures required in an ICU. In 2021, Sarah was recognized as PA of the Year for Distinguished Service in Early Career, Distinguished Service in the Community, and Distinguished Service as an individual in healthcare for her work with COVID-19 patients. After spending 2 years in the COVID-19 ICU, Sarah moved to the medical ICU as one of the first ICU PAs at Canton Potsdam Hospital. Sarah manages to care for critically ill patients. She provides critical care consultation. She performs intubations, placement of central lines and arterial lines. She performs paracentesis, and she teaches medical providers from various backgrounds how to perform these procedures with excellence. Ilya Spaho made it to Clarkson University despite all of the odds. As a refugee, Ilya and his family fled post-communist Albania when Ilya was only a child. They eventually made their way to the United States, where they settled in New Jersey. Ilya completed high school and then attended Rutgers University, where he double majored in biology and laboratory sciences, the cytotechnology track in particular. After graduation, through his work in clinical laboratory, Ilya became familiar with physician assistants when he noticed the credentials on the laboratory order slips he was processing. Ilya had never heard of PAs. He too thought that only physicians were medical providers. Shortly after this, he suffered the indignities of the application process and ultimately made his way into the Clarkson University PA program. 6 years later, Ilya is a member of an elite cardiac surgery service. He is now performing and teaching endoscopic vein and artery harvesting. He is helping propel the next generation of PAs beyond even his dreams. All three of these professionals have defined new roles for themselves within their institutions, roles based on their abilities as individual medical providers. They are setting new standards. They are creating greater possibilities for other PAs. They are opening new doors for the next generation of PAs, and you will too. In conclusion, congratulations on your remarkable achievements. All of the years, the anxiety, the self-doubt, the fear of failure, the tears, the laughter, the discovery, the friends, the triumph, and the heart-wrenching experiences have brought you to this day. Remember the smell of the air. Remember the way the light shines on each of your peers. Remember the voices and all of the laughter. Experience the exhilaration of knowing what you have accomplished. Then go out there and work hard. Show everyone what you are capable of. Raise the bar for the upcoming generation of medical providers. In the words of Elizabeth Blackwell, an 1800s trailblazer in medicine, it is not easy to be a pioneer, but oh, it is fascinating. Congratulations.
Thank you, Imre, for those encouraging words. like to introduce Professor Christopher LaPointe, who will read the history of the white coat.
Good afternoon. I wanted to take a few minutes to talk about the symbolism of the garments that you'll see us wearing today. This day actually marks two events for our graduates. One of them is academic, and the other is professional. There is symbolism in the clothes that we wear for both of these events. First, I'll talk about the academic regalia the graduates will be wearing this evening at commencement. Academic regalia in the United States has a history going back to the colonial era and was most influenced by the academic dress traditions of Europe. This dates back to an era when regalia was used as much for function as it was for symbolism. Gowns were worn for warmth in the cold and hoods for inclement weather. Today, the gown and the hood these students will be wearing symbolize the level of education and the area of study. The gowns are typically black in color unless the university has chosen other color schemes for their regalia. The baccalaureate gown has a square sleeve. The master's gown has an oblong sleeve with an arc cut away from the front, and the doctoral gowns have a bell-shaped sleeve with 3 velvet bands. The hood's coloring and length represent the type of degree, the subject of the degree earned, as well as the institution where it was awarded. The silk interior lining signifies the school colors. When turned appropriately, the Clarkson hood will be gold with green chevron, displaying the Clarkson colors. The outer trim, or the cowl, of the hood signifies the subject of the degree earned, and our students' cowl is medicine green. Now that our students have completed their academic requirements, they are set to enter the medical profession as physician assistants. The other garment, which is used in the clinical area, is the white coat, which they'll be wearing very shortly. Originally, coats for the medical profession were black. These were used when dissecting cadavers, so black was used as a sign of respect for the dead. Scientists, however, used the lab coat, which were beige, but the coat itself was a symbol of science. When physicians aligned their practice with science, the lab coat was worn to gain credibility and trust from the public. In medicine, white became the preferred color because it symbolized purity, cleanliness, and righteousness. It also did not fade when washed in high germ-killing temperatures. The white coat has been the most prominent symbol of medicine since the development of aseptic surgery around 1889. Medical archives have pictures from this time showing surgeons wearing white lab coats which were worn to prevent the patient and the physician from contaminating one another. The white coat ceremony was a recent development originating at Columbia University's College of Physicians and Surgeons in 1993. Now it is a common tradition that has expanded to other professions, including physician assistant, physical therapists, pharmacists, as well as many other healthcare professionals. Just like the hood of the academic regalia, the length of the white coat symbolizes the status of the wearer. The first white coat our students were given signified their status as a learner. Today, they are coated again, but with a longer white coat, symbolizing their transition as a graduate practitioner into the profession of the physician assistant. Next, we'll progress to the main event, the donning of the white coats. Morgan Beldock will read the names, and could you please hold your applause till after everyone is coated?
The following students will be coated by their advisor, Professor Chris LaPointe. Rebecca Behringer. Melissa Bartow. Mike Cavalli. Matthew Nabriha. The following students will be coded by their advisor, Dr. Tushar Sirsat. Matthew Siegel. Megan Parmalee. Mick York. Mary Sherman. Mackenzie Lamon. The following students will be coded by their advisor, Professor Heather McKinnon. Danny Breithopt. Alex Galloway. The following students will be coded by their advisor, Dr. Don White. Amanda Bernecki. Jenna Harmeyer. Taylor Lacey. Moulton. Reed Pelletier. The following students will be coded by their advisor, Dr. Deanna Denault. Abby LeClaire. Amber Murray. The following students will be coded by their advisor, Professor Samantha Lucas. Kylie Bergstrom. Ashley Dubanek. Olivia Niemeyer. Alexander Rabideau. Hunter Templeton.
Thank you, Morgan. At this time, I would like to ask all of our newly minted healthcare professionals to please take your positions up front so that you may take the oath of service. everyone has their program, I'd ask you to please repeat after me. I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will work to constantly support patient advocacy and empower my patient to be active partners in their medical treatment. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community. I will give unselfishly to the local, underserved community where I am identified as a new medical leader. I will work diligently to not only treat diagnosed medical diseases, but to also promote preventative care. I will respect my professional relationship with the medical team with which I will work. I will share and expand knowledge with the profession. These duties are pledged with sincerity and upon my honor. Congratulations to our new colleagues. Another round of applause. Are you set with pictures? You guys ready? Ready. Thank you. You may be seated. I would now like to introduce Mick York, who has functioned as the president of the PA Student Society. He has some words for you. I waited just until you were seated to ask you to come back up. So.
Hello, everyone. My name is Mick York. I apologize in advance. I lost my voice while I was singing en route to picking my parents up. It's an honor to stand before you today as we celebrate a major accomplishment in our academic and professional careers today. I want to start by both welcoming and extending a heartfelt thank you to all the family, friends, and loved ones who can be in attendance today, as well as tuning in via the live stream. We couldn't have done it without your love and support all along this way, so I'd like to give a huge round of applause to each and every one of you. Thank you. So today marks the culmination of years of hard work, dedication, and sacrifice. And as we reflect on our time in this program, we can all agree that PA school is not easy. You constantly hear the phrase that PA school is like drinking from a fire hose. And let me tell you, that phrase is 100% true. Didactic year was one full year of endless flashcards, constant exams, daily stress, more coffee than a human heart should probably ingest, and many, many, many late nights. Thankfully, we have some pretty amazing teachers in this program, and our class was able to both persevere and succeed throughout the rigors of didactic. As we moved on to our clinical year, we got the opportunity to put our knowledge and skills to use. During this time, we got to work in various specialties, seeing a wide range of clinical cases, all the while learning from some pretty amazing preceptors along the way. And I know we have some of our preceptors in attendance, both in person as well as tuning in via the live stream, so I'd like to take a quick moment to thank them for their mentorship, their guidance, and for allowing us to play a role in the care of their patients. And now, having completed our clinical year, we are now ready to enter the next chapter of our lives as practicing PAs. And we have the skills, knowledge, and compassion to make a positive impact on our patients and our communities. We have been trained to provide high-quality care, to work collaboratively with other healthcare professionals, and to be advocates for our patients. And as we move forward in our careers, we will certainly face many challenges and uncertainties. We will encounter patients who are scared, frustrated, and in pain. We will witness the various inequalities that exist within our healthcare system, but we must never lose sight of our purpose. So let's all strive to provide the best possible care for our patients, to advocate for their rights, and be agents of positive change within our communities. Let us embrace this responsibility with humility, courage, and grace, and let us never forget the privilege that we have been given to help others. In closing, I would like to congratulate my fellow graduates on this incredible achievement. We have worked hard, and we have earned our place in this healthcare community. But this is just the beginning of our journey. So let us go forth with gratitude, determination, and a sense of purpose, and let us make our communities better, one patient at a time. And before I finish, you know I had to use our good friend Amanda's favorite saying. Picture this. Around this time next year, we won't be worrying about school, we won't be worrying about rotations, job hunting, credentialing, any of that nonsense. Instead, we might all be planning and taking our first PTO-covered vacation. And now that's something to look forward to. Thank you, everyone, and congratulations to the class of 2023.
Thank you, Mick. We will now do the presentation of awards. Actually, Amber, if you want to come up. Amber Murray will present the Preceptor of the Year award, and then we will also present the Pi Alpha awards. Thank you, Amber.
Hi, everyone. If anyone knows me, I hate public speaking, but when I heard this lady was nominated to be Preceptor of the Year by my class and by me, I couldn't say no. But first off, on behalf of the class of 2023, I would like to thank all the wonderful preceptors who made sure we were standing here today. You put in countless of hours helping us understand medicine, get better at patient interactions, and taught us to be the best providers we possibly can be. You also spent hours listening to us ask silly questions, get medications and treatments mixed up, and say ridiculous things over and over, and yet you never gave up on us. You see our potential. While you all deserve an award for putting up with us on a daily basis, we only had one Preceptor of the Year award to give away this year. This year, we decided it would go to a preceptor that, despite losing her house in a fire, she continued to take us on as students and see our full potential. She showed us unrelenting kindness and patience as we accidentally told our patients to spread their legs during a gynecologic exam, or as my male co-students navigated the insistent mortification of doing their first pap smear. Despite the fact that one of those examples was definitely me, she still liked us enough to join us on our annual trip to Nicaragua to provide medical care to countless people who needed it. Despite the trials she had encountered this year, she gave up her time to help make our medical missions trip a success, and we could not have done it without her. I consider her to be one of the most amazing preceptors I have ever had, and an even better friend. With all of this in mind, I am so honored on the behalf of my amazing class and to offer the 2023 Preceptor of the Year Award to Megan Gagne, DNP and midwife. Unfortunately, she could not make it today because her daughter was offered a travel position for a hockey team in Boston, but she is watching virtually, so hi Megan, you deserve it all, and I hope you know how much you are appreciated by all of us. Thanks.
Thank you, Amber. Pi Alpha is the National Honor Society organized for the promotion and recognition of both PA students and graduates. The Honor Society is sponsored by our Education Association, PAEA. One of the criteria for induction includes a final GPA of 3.5 or above, which greater than 2/3 of our graduating class has earned, making it difficult. So additional criteria for induction include demonstration of significant leadership, research, community and/or professional services, and other related activities. The Society also encourages a high standard of character and conduct among students and graduates. Per the Pi Alpha bylaws, only 15% of the graduating class may be nominated. The PA faculty nominated 4 members of the class of 2023 for this honor. The recipients will receive a letter from the PAEA president, a certificate suitable for framing, a lapel pin for the white coat, and a cord that they may wear with their regalia for commencement this evening. All 4 of this year's inductees excelled not only academically, but also by providing leadership and service within their class and community. I am proud to present the following students with the distinction of Pi Alpha membership. Kylie Bergstrom. Ashley Dubonic. Jenna Harmeyer. And Mick York. Congratulations. It was not an easy choice. You guys are awesome. So in closing, this class came to us during a transitional time. COVID was in full swing, and we as faculty had adapted courses to meet the constraints of sickness and quarantines, while still meeting programmatic standards. Where's Deanna? Nod to you with the programmatics. All right. Most of these changes were fairly new, and as much as we took a chance on them as new PA students, they took a chance on us too, and look how this turned out. All right. So when attempting to describe to incoming students what the workload will be like, we do use the metaphor of the fire hose, but we realize that it is an almost impossible task to fully explain it until you're immersed in it and actually experiencing it firsthand. It is one of the most difficult things that you will accomplish in your life, and each of these students has risen to the challenge. They've demonstrated mental fortitude, adaptability, and devotion to the PA profession, all of which will serve them well as they head out into the world. Preceptors have said many positive things about this class. I'll share a few of these here. Excellent student that has really grown into his role as physician assistant. By the end of the rotation, he was functioning at near the level of an independent provider in the ER. I would not hesitate to hire him. Another, if this student represents the quality of students within the school, I would welcome any student from your program who would like to rotate with us. And one more, if they are all like her, you are lucky. I could go on because we had such a large pool of positive feedback to choose from. It's a great problem to have. Thank you for representing our program, our school, and the university so well. We as faculty, have a duty to teach our students the standard of care, and along the way, we add our own special tips and tricks that have worked for us over the years. I have to keep my hand here to make it stop. Okay. We've added our own special tips and tricks that have worked for us over the years, and by doing this, the students carry a little of each of us with them out into the world, and by default, to their patients. Every year that we send a new class out into the world, I am comforted that while we as faculty are no longer in full-time practice, a piece of each of us lives on and is still out there serving communities all over. We also learn from our students, and from this class, I will take with me a reminder of what it means to be dedicated to a task, no matter what is thrown at you. Believe it or not, you're gonna miss these days. Even the didactic year, you're gonna miss PA school. I know that's hard to believe right now. I myself can still recall exactly where I sat in class because I spent so much time in that seat. I closed my eyes, I could still see the whole thing. You may reflect fondly on your new addiction to mints. And when your skin is flawless in your later years, be thankful that you were always so compelled to wear a hat and sunscreen. You may recall stories told or particular anecdotes a professor stressed, such as, "That's all I have to say about that," at the end of a pharm lecture, or, "You ready for this?" at the start of a sim, or, "It has to make sense," when you're reminding yourself of phys. You may just be glad that I won't haunt you forever about AFib, but maybe, just maybe, you will feel more comfortable walking the line between confident and cocky and always walking like you know where you're going, even if you don't. So as we say goodbye to our students, we say hello to our new colleagues. The faculty, staff, and I could not be more proud of your success and how well you've represented our university, school, and program. Please join us now in watching a slideshow created by our class of 2023 so we can get a peek into what their PA school experience was like. Thank you. This concludes our ceremony. Thank you so much for joining us today and making this a special day. It was a great day to be a Clarkson PA.